Hello, I'm Cherish Thompson, a Public Affairs Specialist for the Sheridan VA. I want to thank you all for joining our Veteran Telephone Town Hall. Our focus this evening for discussion is the PACT Act for the next hour. So joining me is the Director of the Sheridan VA, Pam Kroll.
Hi, good evening. It's nice to be with you all this evening, and I look forward to sharing all the good stuff that's happening at the VA with the PACT Act.
Also with us this evening is the Director of the Cheyenne VA, Paul Roberts.
Hello, good evening, everyone. I echo those same comments and looking forward to this evening's event. Thanks for joining us.
And also joining us and starting off our town hall will be the Regional Executive Director of the Veterans Benefits Administration, Mike Robach.
Hey, good evening, everyone. Happy to be here. Looking forward to the call.
The goal of this event is to provide you with helpful information and an update on how this legislation of PACT Act impacts you. As I shared, PACT Act is the sole focus this evening for our town hall, and it's a huge topic to cover. We're now going to start the presentation with an overview of PACT Act by VVA's Mike Rohrbach. Mike?
All right, thank you, Cherish. And welcome to the call, everyone. Again, my name is Mike Rohrbach. I'm the Cheyenne VA Regional Office Director, so I deal with disability compensation benefits for VA. But we're going to talk about the PACT Act. I'm going to give you an overview of the PACT Act, and I'll spell out the PACT Act for everyone who doesn't know what it is. And then after that, we'll go into sort of three components of the PACT Act that we want to talk about specifically for this call, which is veteran registry, disability compensation and pension benefits, and then health care benefits and services as well. So what is the PACT Act? The PACT Act is the Sergeant First Class Heath Robinson honoring our promise to address Comprehensive Toxics Act of 2022. You'll see a lot of information coming out. Everything states the PACT Act. That's the long version. That's the long name. For short, it's the PACT Act. It was signed into law on August 10th of 2022. So just the past couple of months it was signed into law, and this is perhaps the largest benefits expansion in VA history. And so we're excited about this, and we've been working on this actually well in advance of this being signed into law. This will greatly expand benefits and services to veterans exposed to burn pits and other toxic substances. And this will help VA provide generations of veterans and their survivors with care and benefits they've earned and deserved. So I'm going to really cover 8 sort of overarching topics for the PACT Act. The first one, these are the major components of the PACT Act, and these are the benefits and services that it will provide to all of you, veterans, survivors, caregivers, and dependents. So the first is it expands and extends eligibility to VA health care for veterans with toxic exposures, and veterans these are specific to veterans of Vietnam era, Gulf War, and post 9/11 era veterans. It improves the decision-making process for determining what future medical conditions will be considered presumptive in nature. This will actually give us an opportunity to actually make presumptive disabilities open for future instances. It'll also provide initial veteran screening to toxic exposures and a follow-up screening every 5 years for veterans. It expands Agent Orange exposure locations and disabilities and establishes presumption of service for 23 respiratory illnesses and cancers related to burn pits and airborne hazards exposure. Next, it also improves and expands training for VA healthcare staff and claims processors specific to toxic exposures. It requires research studies on the mortality of veterans who served in Southwest Asia during the Gulf War post 9/11, veteran health trends, and veteran cancer rates. It increases resources and builds a stronger, more skilled workforce to meet the growing demand for benefits and services by way of the PACT Act, and authorizes 31 new medical facilities across the country, providing greater access to VA health care. So I know I went on a lot of overarching high-level information there. We'll get a little more information again coming up on the registries, disability compensation and pension, as well as health care. So with that, I'll turn it back over to you, Cherish.
All right, thank you, Mike. We are going to be covering a lot of information tonight, and there is still some more to share. For your reference, VA has provided a link at va.gov/PACT, P-A-C-T, with the links to resources on this act. Again, if you have any questions during the call and would like to ask them, you can press *3 on your phone at any time to get into the queue to ask. A member of our staff can collect your question, and then we'll answer as many as we can at the conclusion of our presentation. Next, to speak to you about toxic exposure registries is Sheridan VA's Director, Pam Kroll. Pam?
Hi, good evening. I just want to thank you all for being here again, and I also want to thank you for being here on Election Day. You may wonder why we picked November 8th, and one of the main reasons is that today is the official kickoff for the toxic exposure screening and the registries, and so that's going to be the first thing I talk about. So a message went to all of VA employees today with a reminder that today is one of the implementation dates for Veterans Health Administration. So there are multiple registry types, and to be on the registry, there are standardized questions, and it's a way for us to collect data. And we've had the open burn pit registry for a while, but it helps us understand potential health effects of the particulate matter in burn pit exposures and proactively identifies health concerns that veterans can talk to with their healthcare providers. It also, we have registries for airborne hazards as well. Participation is voluntary and will not impact your VA healthcare access or compensation and benefit claims. The registry itself is not a comp and pen claim. And just to comment about here in Sheridan, we didn't wait till the November 8th date to start. We've been doing this for a while, and we have a provider that is traveling the 75,000 square miles that we cover in Wyoming to take appointments regarding these registries and to start that process. So I did just want to mention that was one of the reasons why we picked today. So I'm going to turn it back over to Mike, and he's going to talk about the comp and pen aspects of the PACT Act.
All right, thank you, Pam. Like I mentioned before, the PACT Act is really going to expand benefits and services greatly to millions of more veterans than before. And I'll talk specifically to the disability compensation realm of VA for those that were exposed to toxins while they served. And that's specific to those 23 new presumptive conditions for burn pits and other toxic exposures, and the addition of more presumptive exposure locations for those folks that served in the Vietnam era and were exposed to Agent Orange and radiation. But I'll throw this first out there to everybody. I'm going to throw this out there a couple times because it's information you will need, so write this down. But details regarding the new presumptive conditions and new qualifying service locations can be found in detail if you visit va.gov/PACT, P-A-C-T. And that's va.gov/PACT. So what do we mean when we talk presumptive conditions? This is sort of my wheelhouse that I've worked in, and every day is provide disability compensation. A presumptive condition for toxic exposure as it relates to disability compensation, I think is very important for everybody to understand. And I'll start with, to get granted a VA disability rating, to be found approved for that, a veteran's disability must be connected to military service. For many health conditions, veterans need to prove the service caused the condition. But for some conditions, VA automatically assumes or presumes that the military service caused the condition. And so when a veteran has a presumed condition, they don't need to prove that to the VA that their service caused the condition. They only need to meet the specific requirements for the presumptive condition, such as being diagnosed. So, for an example, it was being diagnosed with chronic bronchitis and having served in Iraq or Afghanistan on or after September 11, 2001. That veteran doesn't need to show proof that that was caused by the service. VA will automatically assume or presume, based on this law, that that was caused by service. And so it really provides a veteran quicker access to benefits. It's already a presumed condition. Veterans don't need to go out and gather a bunch of medical evidence and information dating back to the time they were in service. They just need to file their claim with the VA, and we will be able to move that forward. One thing we know is that the conditions outlined in the PACT Act have already taken a serious toll over the years on many veterans and their families. And so with that, VA has decided to expedite the timeline to deliver benefits to veterans and survivors as soon as possible. And by that I mean, in the legislation, we were supposed to have a phased-in approach for when we start granting disability compensation for specific conditions. Instead of phasing in the conditions over the coming years, as outlined in the legislation, the VA decided to make all conditions in the PACT Act presumptive for benefits as of August 10th, the day the bill was signed into law. We'll begin processing these benefits as early as possible, starting January 1, 2023. When we start processing claims on January 1st, we will prioritize all cancer claims to make sure those folks get timely and access care and benefits they need. And generally, if a veteran applies for benefits anytime before August 10th, 2023, so next August, and the application is granted, that person will receive benefits backdated to the date the bill is signed, August 10th, 2022. So again, we're having different phases to granting benefits. As it was stated in the legislation, we are going to process all claims starting January 1st, 2023, with an effective date of August 10th if you get that claim in within a year. And so with that, I will go into some of the things that we've already done preemptively on the benefit side to make this, to implement the PACT Act smoothly. But I'll first start with, throughout my VBA career, we've implemented many changes, and I have to say I think we're the most prepared to implement the PACT Act. A few things we've already implemented to ensure success is we've expanded hiring and training for claims processors across the country to accommodate the significant increase in veterans and survivor claims. We anticipate millions of more claims every year, disability compensation claims, and for that we're hiring thousands of more claims processors to meet that need. We don't anticipate a huge backlog like folks may have seen in the past. A decade or so ago, we preemptively hired staff to process these claims in anticipation of this bill being passed. We've also prioritized over the last year automation of new claims related to toxic exposure conditions to help streamline and focus our personnel on decisions that are complicated and need a person to make a decision for. We have and will continue to solicit, just like we will today, veterans to file claims for these new PACT Act presumptive conditions. So we're soliciting veterans